Hello, my name is Kimberly Thompson, and I am a student physical therapist assistant from CBD College. In this scenario, were there any laws that were violated? If so, which ones? Please explain and provide a reference for your response. Number one, by initiating the treatment without a PT evaluation, the PTA violated the standard practice guidelines for PTAs, specifically the direct supervision requirement. Reference found at www.fsbpt.org. Number two, the patient has a history of stroke and neurological deficits. The PTA should have taken extra precautions and assessed her for balance issues that could increase risk of falls. The failure to do so may indicate a breach of the standard of care, which is grounded in the legal requirement to act in a manner consistent with what a reasonable PTA would do under similar circumstances. Reference found at Chapter 10, Laws Impacting PT Practice, the role of the PTA in the book. Number three, the PTA's failure to document the fall and lack of response to addressing the patient's injuries might also be a violation of standard of care. Reference found at Chapter 10, Laws Impacting PT Practice, the role of the PTA. Number two, what should Ms. Rodriguez have done differently when she realized there was not a prior evaluation? Upon realizing that there had not been a prior evaluation by the physical therapist, the PTA should have stopped the treatment and immediately contacted the supervising PT. How else did Ms. Rodriguez fail to provide adequate care to the patient after the fall? The PTA did not provide any first aid or assess the patient's condition after the fall. If there were signs of significant injury, like pain or bruising, she should have assessed the situation and initiated basic first aid or called for emergency medical services if necessary. Failure to document the incident. As part of her professional duty, the PTA should have immediately documented the fall incident in the patient's records. Failing to do so could impact the quality of care and would be problematic from a legal and ethical standpoint. The PTA failed to communicate with the patient or her daughter about the fall or its potential consequences, which could have led to more immediate medical attention. In this scenario, is there a reason why Ms. Rodriguez went ahead with the treatment, and who is liable in this case? I can't see any reason why the PTA chose to proceed with treatment. In this case, the PTA is liable for failing to follow legal and professional guidelines that led to the patient's injury. The PT may have some liability if they fail to provide supervision of the PTA. What would you have done in this scenario? Upon realizing that there had been no prior evaluation by the physical therapist, I would not proceed with treatment until I had contacted the supervising PT.